Good evening from Rocky Mountain PBS. I'm Cynthia Hessin. This is Colorado State of Mind. Tonight we have for you a program in two parts. In the second half, we will meet Dr. Rich Mahogany, a humorous online therapist who talks with men about their feelings. Underlying the clear comedy value, there is a serious intent from the Colorado Department of Public Health, and we will talk with the creator of mantherapy.org. But our first topic tonight is the college class of 2013, emerging from thousands of institutions around the country in the past month. What kind of climate are these men and women coming into, looking for jobs, and how does their student debt affect the rest of the U.S. economy? The Nation magazine published a new report this week calculating what they term the true size of the student debt crisis. Their numbers, drawn together from Federal Reserve reports, show 38 million borrowers. 20 million of those have started a repayment plan, and of the 20 million, 31%, a third, are seriously delinquent. That comes to 6.2 million Americans in danger of defaulting on their student loans, or as this magazine happens to point out, that's more than the entire entire population of Colorado, worried now about that kind of debt. Let's talk about it now with Rich Wobbekind, University of Colorado Leeds School of Business, an economist there, and Melena Postolowski of the Daniels College of Business Career Center. And to my right, my friend Al Lewis, columnist for the Dow Jones Newswires and blogger at tellittoal.com. So, Melena, you are right in the eye of all of this, where young people their unemployment rate is higher than everybody else's unemployment rate. What are you seeing right now at Daniels?
Definitely. So the specific student population I work with are graduate level business students, so MBAs and specialized master's degrees. The employment demand for those students is increasing. It has been increasing for the past 5 years, but it still is challenging. It's definitely a competitive market, and there are a lot of concerns in this area, especially for students. So we're definitely seeing students get employed months out of graduation, but would like to see more students getting employed upon graduation.
I see. So there's a lag time. But it does seem to point out that extra education like that, a graduate degree, does give you better prospects.
Absolutely. If you're a young professional and you want to position yourself in the field, it does help to have a graduate level degree, and you are going to be having a higher salary with that as well.
All right. Well, we'll come back and talk about fields that really seem to do better as well. But let's talk about this $1 trillion in student debt, which is more than all the credit card debt in the country. It is second only to mortgage debt in terms of the amount of money called for in it. That's not the right way to put it, but you know what I mean. What does this threaten to do to the economy as we look forward?
Well, overall, I mean, the concern is that this is going to change household formation, and particularly the purchases of homes or even potentially automobiles, and two major drivers of the standard economy. And so when students are coming out of school and they have this significant amount of debt that they have to service first, that's the first thing that's got to get paid. And of course, the last 5 years haven't helped the situation. We had high unemployment rates among 18 to 25-year-olds. They weren't able to get jobs. It's one of the reasons you had the kind of statistics you were quoting, that they haven't been able to pay off their debt. There really isn't any good way to put a stay on your loan when you're unemployed. So there's a lot of issues there that need to be addressed.
And we have this deadline coming, July 1st. If Congress doesn't do a different thing, the rate of interest loans for students is going to double?
It's going to rise to 6.8%. And I think this just shows you what a criminal financial society that we live in right now. You can get a car loan. You can get a car loan for 3%. You can get 0% car loan, right? You can buy all kinds of appliances. You can get 0% interest at Home Depot, right? But student loans, 6.8%. The banks in this country borrow at less than 1%. Senator Elizabeth Warren has a bill out that says, you know what, students should be able to borrow at the same rate as banks. I mean, why not? We have to bail them out when they fail. But no, there's various proposals in Congress, and probably what we'll end up with is hopefully not that 6.8% rate, which is really high. Because what we're saying is, don't go to college, buy yourself a Ford Mustang, right? That's what we're saying to people. But I think that we'll end up with something where 3.5 or, something that floats above the 10-year Treasury. And I really think we need to examine this. Why are we making it so hard to borrow to go to college and so easy to borrow to buy stuff that we're just going to consume?
And it's striking because if you don't have a college degree or above, a graduate degree, your real income has fallen in the United States over the last 30 years. So high school graduates and below, dropouts, et cetera, have really fallen. And historically, the U.S. economy, when it grew, the rising tide lifted all boats. But it's not lifting all boats right now. So the education becomes more important than ever in terms of income levels, but at the same time we have this issue of debt and debt financing.
And yet you're hearing all these people say, don't go to college, you know, and if you do go to college, make sure you can get a job in whatever degree that you have. And that these colleges are all scammers. They tell you, don't worry, you'll get a job, and you borrow all this money and you go to school. But the thing of it is that if you don't go to college, you know, your choices are limited as well.
Very limited.
Even more limited.
Right. And I think a study that I heard about from Georgetown this week talked about how the labor market is demanding more and more specialization, that you aren't going to do as well if you have an undergraduate degree in psychology, say.
Mm-hmm. Definitely. So I do have an undergraduate degree in psychology.
And you're doing fine, but you went on
yes.
for the graduate degree.
Correct. And it's still, you know, options still can be limited in my particular field. So it does really depend on what you want to do and how you brand yourself and how you're able to market yourself. And networking is huge. You could be the best student in class and you don't have the right connections, you're not going to be able to find employment. So,
what fields? Well, we know, of course, healthcare is big. Any surprises in what is a coming field?
Definitely. So a lot of our students want to be targeting consulting and finance and accounting and products and services, and that's great. Those are all good areas to get into. But as you mentioned, healthcare is an up-and-coming field, and so if MBA or MS students can market themselves for those positions, that's beneficial. There's a high demand for those students in that area. Also, energy and utilities, and technology, of course, is always going to be up there on the list.
Yeah, and data for sure. Right now, big data is a dramatic increase in demand for jobs in a wide variety of backgrounds. But being able to analyze large data sets, being able to draw inferences from those, runs from marketing to supply chain. It runs many different parts of businesses and across many different industries, the ones that were mentioned and others. So it's not industry specific as much as it is sort of skill set specific.
I see. Now, you are a father of two people who have student debt they're paying off. Talk about that a little bit.
Well, you know, to me it's a little frightening because one of them is a medical doctor and has accumulated a fair amount of debt in that process, which is not unusual. My younger daughter just finished her master's in public health and accumulated 2 years of fairly significant debt at a private school. So I, you know, in the back of my mind, I have this concern, but I also, you know, going back to my earlier comment, I also know that it is unlikely they're going to have good career paths without this type of training. And they've been fortunate, both of them, that they have gotten employed and they are moving forward. And so it's just a question of servicing that debt while potentially servicing other debt like homes, home loans, or car loans.
Al, in these bills that Congress, various people in Congress and the President have come up with, is there one of them that is trying to take a longer view of what it would mean to have $6.2 million or 6.2 Americans defaulting on debt?
I think that the mindset in Congress is we need to fix this before July 1st. We can't let it go to 6.8%. And there are various bills that say let's just freeze it right here where it is, 3.4%, and then we'll have another year to discuss this some more. You know how Congress likes to kick that proverbial can down the road, as they say almost every day on the Hill somewhere. But I think that's what this is. They just can't agree on this. But you think about what Rich just said about something like big data. Right? The future is big data. We're going to have the ability to process more data points. And we're not talking about millions of data points. We're talking billions, maybe trillions of data points. And the skills, the mathematical ability, the analytics that are going to go into this are going to be enormous. And they're going to have all kinds of applications that even do our everyday lives, being able to get information out of all these little data points. That requires master's degrees, doctorates. And we're saying, yeah, you can have one of those, 6.8% interest, and you're well on your way. That's screwed up. Okay, that is really messed up, and Congress needs to be thinking about this, because otherwise we are just going to be raising another generation of useless consumers who, basically, eat more than they produce.
Rich, where are we in the state of Colorado with unemployment at this point? How have we done with the recovery?
Actually, quite well. We're under 7% at this point as a state. And so we're, it's dropped down below the national numbers, and we're very close to being back to the same level of employment that we were at prior to the peak. So at the prior peak. So when we're right now, we're about 400 jobs below our previous peak. The nation is still down about 1.8 or 1.9% from the previous peak, so we've done much, much better than the nation, and especially sort of in the metro area north. We've really had very significant job growth across, frankly, almost every industry, with the exception of information and mining. Everybody else is growing, and some of them are growing at very good pace. Year-over-year job growth right now is over 63,000 jobs, about 2.6%, so very healthy right now.
But of course, the rate is higher, isn't it, for younger people?
The rate has been higher for people, and some of this may be obvious, and we did see a lot of people, I should say my age, getting laid off in this recession too. It wasn't just a young person's recession, but then there was so much talent out there, and people willing to work for lower wages, that as new people were coming out of college, they were having a much harder time finding those jobs. So we really do have high school graduates and college graduates from the last few years with higher unemployment numbers.
Melena, the people that are coming out of Daniels College, are they coming out with 2 or 3 offers, or just one? Or
I think it depends on the candidate, depends on the field. So accounting, for example, we have a very high placement rate for accounting students. Most of those folks find something, and they find something well in advance of graduation. Other folks, it does take some time after graduation to find something. I think I heard a statistic, it takes about 1 month for every $10,000 you want to earn, and so for folks, especially MBA level folks, that might mean a while of job searching.
No. That's an interesting rule of thumb.
Yes.
I hope it's not true.
Now, your child, speaking of progeny here, your son is young, so you aren't facing the college education anytime soon. What will you do when the time comes will you advise him to take on debt?
Absolutely. I have a very positive view of the future. I think around 2020, this whole thing is going to turn around. I mean, we don't stay in depressions forever. There's a demographic argument to be made that this millennial generation goes into their peak earning and spending years around 2018, 2020. They start to revolutionize the economy in ways we can't envision right now, just as the baby boom generation did in the 70s. The 70s were a very dark time, and then we came along, right? And we invented the internet and all these things, and we had this big explosion.
And everything we
did, the millennial generation
splash,
could do this. And my hope is that this game that we're playing, this financial shell game that we're playing from the Federal Reserve on down, and even with the national debt, gets us through to that point. If we can just get to that point, I think that we'll be all right. And I think my kid is just going to hit it right. He's going to get out of college, and they're going to be like 10 job offers, because there just won't be enough kids to fill them all. But maybe that's just too optimistic. It's great to make predictions that are
startling.
Yes, but if you make your predictions that are 7 to 10 years, no one will remember the show then.
Speaking of kicking the can.
No one will say whether I was right or wrong. But seriously, I mean, things are actually getting better right now, and the only problem that we have is that we have a Federal Reserve that's pumping all this money into the economy, and the minute they stop, we don't know what's going to happen, right? And we got all this national debt piled up. It's going to be $20 trillion before Obama's done, and nobody knows what's going to happen when interest rates go to a normal level like 4%. Then we'll be spending $1 trillion a year just on debt service. Nobody can answer any of those questions right now. Those are the scary unknowns. But other than that, everything's getting better.
Oh, I actually agree with your positive side. I mean, the Georgetown Center that you mentioned earlier, their job projections in the 2020 range are actually not enough labor in the U.S., not too much, but it's definitely not enough labor shortage in the U.S., and so that's a big concern. But I do think what goes into that, as you've been mentioning, is really important. How much debt that population is going to be carrying for the rest of us. What are going to be the burdens on them? What's the future burden, if you will, of what we're doing right now?
We must leave it there, and that is the time we have for this part of Colorado State of Mind tonight. Thank you, Richard Wobbekind, Melena Postolowski, and Al Lewis, for giving us your outlook tonight. That's more positive than we were expecting. Our next guest is really only virtual in a certain way. Let's have him introduce himself, and then we will talk about the real behind the virtual.
Did you know that men have feelings too? No, not just the hippies. All of us. Hello, I'm Dr. Rich Mahogany. Welcome to Man Therapy. Go ahead. This is your time. Click one of the buttons above to continue. Are there buttons? They said there were going to be buttons.
Dr. Mahogany is a creation of Cactus, an ad agency in Denver, for the Office of Suicide Prevention at the State Department of Public Health. And in this very manly appeal, they hope to get more men to take some advice with the humor.
Men have a way of doing things. A man has his way of eating, of exercising, of keeping his hands warm, and of straightening up. So, when a man faces a serious life problem like divorce, depression, or suicidal thoughts, shouldn't a man have a way to deal with that too? Well, now he does. I'm Dr. Rich Mahogany. Visit me at mantherapy.org.
Let's go behind the curtain now to talk with Joe Conrad, founder and CEO of Cactus. And this is a Cactus creation. I know that there are some sobering statistics, sobering reasons behind this because of the number of suicides, particularly among men 25 to 54. But over just about a year, this has become a much broader men's mental health campaign, hasn't it?
Yes, it has. When we began to work on the campaign some 4 years ago, we really delved into the issue of suicide in America, and specifically in Colorado, and it really does affect working-age men at a much higher rate than other people. So we wanted to understand that. So we looked at what else had been done around the country, and there really were no communications campaigns that addressed this issue that were created specifically for working-age men. And we really felt that their situation was very unique and very different. And there's a huge stigma in this country around mental health in general, and it's particularly poignant around the stigma around mental health with men. They just aren't accustomed to talking and sharing their feelings, and so we felt like a very unique, customized approach for them was necessary, and so that's where the campaign kind of came from, as looking at the issue from that perspective. And then as you developed it, I mean, you can tell the first key component was the man playing Dr. Rich Mahogany. Where did you find him? Dr. Rich Mahogany is an actor. We knew that he was central to the success of the campaign, is really finding somebody who could pull off that character. And we searched all over the country for the right person, and we were lucky enough to find him in Denver. Oh my gosh. So Rich Mahogany is played by John Arp, who is a Denver stage actor, and he just brought so much to the role. Very fortunate to have him and everything that he brought to it. Well, we're going to see a little bit more of him in just a moment, but I assume then you developed the kinds of things he's talking about with mental health professionals who gave you the messaging? We absolutely did. So, you know, from a communications and an advertising perspective, we always look at what's the best way to be effective. How can we be the most compelling and relevant to individuals with our campaigns? And so we knew that suicide prevention was ultimately our objective, but we didn't want to do a crisis line because we felt like if we did a suicide message, if we waited until men were in crisis, there's a lot of suicide hotlines out there already that people can find out about, and we felt like we would be too late. So our strategy was to go upstream and try to help men connect the dots into things that are going on in their life and catch them earlier on. So kind of, you know, point out where they may be having issues with substance abuse or depression or anxiety or stress and help them deal with that more proactively rather than wait till it becomes a crisis. So that's when it really went from becoming a suicide prevention campaign to really more of a men's mental health campaign, and getting guys to realize that no matter where you are in life or what issues you may be dealing with, that we all could get a little bit stronger and more in tune with our mental health status and things we could do to improve it. So right there on the website, therapy is happening, as you have told me, and this is, of course, the medium that you would go to, right?
online for this day and age.
Yeah, absolutely. We felt like making the website the centerpiece of the campaign was essential, because oftentimes our research showed us that guys were searching for answers, and oftentimes you do that anonymously, where you can't be tracked, and oftentimes that happens online. So we really wanted to create an intervention that was very welcoming, that greeted men, kind of broke through the stigma with just a fresh attitude and a straight talk approach. And, using the website and a character to draw guys in and demystify counseling and therapy and to deliver it in a way that they could relate to would be a really effective way to do that. So really the whole website experience is like going to a virtual appointment with Dr. Mahogany. And so that's really the experience that we created online.
Let's take another look at a clip from Dr. Mahogany where he is talking to someone who's probably new at the site.
Man therapy is a place where men can come to be men. So here, we won't be complaining, whining, or moping about. No, we'll be getting off our keisters and form-tackling feelings like anger, stress, sadness, substance abuse, and even suicidal thoughts head-on. By using the manly techniques found in my office, you'll have tools you need to deal with the tough situations life sends your way, like breakups, layoffs, and your pain-in-the-ass teenager. And man therapy isn't just for men. It's also for anyone with a man in their life. So if you're here because you're worried about your son, husband, brother, or brother from another uterus, be sure to check out the Worried About Someone section below.
He is just very engaging and funny,
wonderful.
So I would think, so how is it done here for this past 11 months?
Yeah, we launched in July of last year, and we launched in Colorado, but really, because it is a website and with social media, when we launched, the New York Times wrote a feature article about it, which was great, and it gave us global exposure and drew a lot of traffic to the site. So we've had more than 300,000 unique visitors to Man Therapy. About 50,000 of those have come from Colorado. So by and large, most of the visits are from Colorado because we've done a lot of outreach throughout the state with partners to do outreach on a community level, and we've done a lot more PR here. But just because of the word of mouth and the spread on the internet, it really has gone global and has gotten a lot of traction and attention. And so it's benefiting programs and men all over the country. And unfortunately, many suicide prevention programs are grossly underfunded, and so it's nice that we've created a campaign that we're allowing other states and organizations to tap into, and it's proving to be very effective in not only engaging men. The average time spent on site is about 6 minutes, so people are spending a lot of time on the site. We have a therapy assessment tool called the 18-point head inspection. We've had 40,000 people complete that survey, which is really an in-depth evaluation of your mental health status and gives you recommendations and action items of things you should do to seek treatment and recovery. So it really is a very robust experience.
And mental health is so very much in the public eye in this year, I would say, but even this week, right?
It absolutely is. We really felt like this tipping point is approaching very quickly around mental health awareness in this country and mental health literacy. And just this week, President Obama hosted a convening in the Rose Garden of the White House with mental health experts and leaders from around the country. And it really is a call to get more proactive, to do more early intervention and prevention, and to educate the public about mental health and the importance of it in creating a strong, healthy society. And so it really is a very timely issue, and we think that our campaign is right there in line with that.
And he talked about, I'm sorry, did you just say this? We'll cut this. Did you talk about him trying to cut the stigma?
Yeah, I just read the headline in the Denver Post today was that the president used the line that it's time to break the stigma around mental health. And so that's what our campaign does. And from all the campaigns that we've seen out there, this little campaign out of Denver, Colorado, we think is exactly the type of message and the type of solutions that we need to get out in front of this issue.
So how do you measure how effective it is for an individual? For instance, what is he doing when he's spending 6 minutes on the site?
Yeah, that's a great question. You know, we really look at the performance and analytics and metrics and analyze that as much as we can to get smarter and to enhance the campaign going forward. And so we've been very keenly interested in what parts of the site people are spending time on and what they're getting the most benefit out of. So just by using web analytics, we can see what parts of the site they're going to, where they're visiting, and what is providing the most value. But we also have survey tools on the site. So as you're going through at critical stages, there are pop-up questions that ask about the effectiveness of what you just experienced and whether or not it would influence you to take action and to do something about it. And so we're seeing really encouraging numbers. For example, of the people that complete the 18-point head inspection, we've had 85% say they plan on definitely using the tools and recommendations that have been given to them. So it really does show that people are getting a lot out of it as intended.
Well, it is definitely humorous and entertaining, but great that it can do this other duty, this very serious duty of getting more men to talk about their feelings. So are you a man who talked about your feelings before this all came up?
That's interesting. I probably am not. I'm probably atypical, or I'm probably very typical when it comes to that stereotype of guys. And yeah, I think we're all a lot more aware, I know, at our own office about this issue and about the prevalence of mental health in our society. And I think women are just wired a little bit differently. They have their support systems and they're more able to and willing to share their feelings, and I think that's a great thing, and men can learn a lot from that. So we've got a long way to go, but hopefully it's with things like this that just make it okay. Because, we've seen where, whether it's in rural areas where men are isolated on job sites or in the military and the issues that they're dealing with, there just are a lot of unique things that have created the situation, and so we think it's going to take a lot of creative solutions to change the tide on that.
And that is Colorado State of Mind for this weekend. You may see it again or any of our programs at video.rmpbs.org. Thank you now to Joe Conrad of Cactus. Very entertaining way to look at men's mental health. Next week, we here at iNews at Rocky Mountain PBS will debut a new documentary, Losing Ground, The Cliff Effect. The documentary airs Thursday night at 8 o'clock, and then the next night here, Friday, on Colorado State of Mind, we will talk more about this cliff effect, which is a sort of trap in the public assistance rules that keeps thousands of families struggling here in Colorado. Hope you'll join us for that next week. Thanks for tuning in for this edition of Colorado State of Mind. I'm Cynthia Hessin. Good night.